course, is very important to understand that your atrial function and the ventricular function. So we talk about the septal defect, right? Atrial defect and ventricular defect. The septum is a division between right and left. So if there's a defect on the atrial, okay, atrial septal defect. If there's a defect on the ventricular, that's what we call ventricular septal defect. We're going to enhance the information in our pediatric discussion, okay? Our congenital heart defects. Now, how many chambers do we have in our heart? We have 4 chambers. We have the right atrium, we have the left atrium, we have the right ventricle, and we have the left ventricle. The right side of our heart receives unoxygenated blood. The right side of our heart receives unoxygenated blood. The system, of course, will be using the oxygenated blood. After using the oxygenated blood by our system, the end product will be unoxygenated. This unoxygenated will be passing through on this what we call superior as well as the inferior vena cava. So going to your superior and inferior vena cava, it will be given to your right atrium. From right atrium, it will be given to your right ventricular. But there's what we call valves. We have 3 valves on our right side, known as tricuspid valves. From right side or from right ventricular, it will be given to our lungs. And you know our lungs receives unoxygenated blood, correct? Lungs will perform oxygenation. Once the lungs oxygenated the blood, it will be given to the left side. We have our left atrium and we have left ventricular. On this left atrium and left ventricular, in between those areas or chambers, there are 2 valves known as bicuspid, or also known as mitral valves. So the mitral or the bicuspid is a passageway between left atrium and left ventricular. From left ventricular, it will be given back to the system. From left ventricular, there's a passageway of oxygenated blood, and it will be given back to the system. And that passageway from left ventricular going to your system is what we call aorta. Okay?